healthcare sector in the GCC is booming dramatically. According to the recent reports, healthcare spending across the Middle East and North Africa region is expected to grow to $144 billion by 2020, with GCC nations alone contributing around 52% of the total healthcare expenditure. There are nearly 350 hospital projects currently underway in the region, and all are designed to enhance vital healthcare infrastructure and increase the availability of specialized facilities. Despite the robust growth of the sector, the region's healthcare system falls behind the international medical practice, quality standards, and lags in the number of qualified professionals. Hence, it is critical that GCC creates a robust and integrated healthcare system that seeks to promote healthy lifestyles, improve patient safety, reduce waste, and minimize healthcare costs. To discuss on the challenges faced by HR community on verifying the competencies of medical professionals in GCC, I welcome our esteemed panel of experts. First, I invite our esteemed moderator of this panel discussion. She has been working in healthcare human resources and recruitment for almost 7 years. Her last 6 months have been spent working as Group Recruitment Manager of Saudi German Hospitals, KSA. Overseeing the recruitment for 5 multi-specialty tertiary level hospitals, she has already recruited 26 senior roles for the business, which would have otherwise cost over 1 million SAR in recruitment agency fees. She spent her first few years of work experience recruiting consultant doctors and senior nurses for many clients across the GCC region whilst working for recruitment agencies. She also recruited a part of team at HCL Workforce Solutions, which was instrumental in recruiting over 100 emergency medicine physicians into the United Kingdom, which eased pressure on the NHS. Ladies and gentlemen, please put your hands together to welcome Ms. Helena Gobert, Group Recruitment Manager of Saudi German Hospitals Group, Dubai. Ma'am, I request you to take over.
Thank you very much. Thank you everybody for being with me here today. So we are going to have a panel discussion, and I have 5 industry experts with me that I'm now going to introduce and ask to come up and sit down beside me. So the first name I'd like to call is Nawab Dr. Shafi Al-Mulk, who you were introduced to previously. He is the president of the World Medical Council and chairman of many healthcare HR IT companies. Next up, I would like to invite Mr. Sohan Roy, the Vice President of the World Medical Council and founder chairman of Aries Group. Next up, I would like to invite Dr. Vinod Thampi, CEO of Al Halia Medical Group UAE. Next up, I would like to invite Dr. Ajit Kumar Nagpal, Chairman and Board of Governors at Ridnad Balved Medical Foundation. And last but not least, Dr. Raza Siddiqui, who is CEO of Arabian Healthcare Group. Excellent. So as discussed, the panel discussion title today is Competencies of Medical Professionals in the GCC. Now, this is something that I'm very much interested in, being a group recruitment manager and working in recruitment for the last 7 years in the Middle East. So I have 6 points today that I would like to speak about, and then I will open the floor to questions with my panelists right here. So the first point we're going to talk about is present HR recruitment issues faced by medical establishments. The first thing I can say around this is global shortage of healthcare talent. Now, the UAE is hugely reliant on overseas doctors, and in fact, about 80% of our healthcare workforce does come from overseas. So with the UK, US, and Europe fishing in the same talent pool, it leaves us HR professionals having to really offer attractive packages to healthcare professionals to entice them to join us. Now, I'm just going to pass over to Dr. Mulk. Could you let me know your thoughts on this? Oh, you've got your own microphone.
Can you repeat that question for me?
Yeah, so we're just talking about the present HR recruitment issues faced by medical establishments here in the UAE and GCC as a whole.
Regarding the doctors, you're talking about the staff.
Correct, yeah.
So that needs to be very specific here.
Yeah, well, perhaps we could start with doctors.
Yeah, I think there are 2 elements here. When you talk about the doctors, professionals, there's a huge pool in the HR portals when you go try to reach out, trying to get the best doctor for your institute. Unfortunately, I think probably people are coming from 130 countries. I'm not sure. I think Dr. Thambi knows much better. So we are trying to recruit Dr. Raza also knows that from 130 countries, different professionals coming with different credentials. So it's very important that when you try to pick up the best heads, in my opinion, probably I think I've been fortunate sometimes in my institute where I pick up the best heads, and we didn't replace for 13 years.
Fantastic.
Yeah, she has been around and a couple of radiologists around. But we were also very unfortunate we need to replace them in next 3 months. You know, what happens here is, I think probably if you look at the whole process, we go there, we depend on the HR, we expect these guys to pick up the best heads. We spend a lot of money in terms of the first start with a recruitment fees of 1 month salary. You're saying 50, 60,000 with due respect to the doctors' professions, plus the visas, the labors, the ministry of everything. You're completely at the mercy of HR. HR is our angel. HR is our, I don't know. He is the closest to my heart. He is still right now. Sometimes I yell at him because he disappointed me. But that's the secret, I think. HR dictates how you could be successful in life. The next guy who comes in there could not be better than him. That's what he impresses on you. I think all the HR guys here, I think probably this is what you do with your chairmans. You tell him, this is the guy for you. Take it, sir. I think probably he's the best. So I completely rely on HR people with the trust factor there. So sometimes what happens is, in the next 30 days, as you see along, you're pretty disappointed with the skills. You know, there's something, there's a factor called SAT. The skills, the aspirations, and the trait. That's what they say about a employee. If that's not matching to your what you want, probably he's not your fit. If he's a misfit in your institute, you need to live with him or you rectify him. Rectification takes time and it takes efforts, and it costs money, costs time, costs resources. So what we do is, probably the first time you want to be lucky, and with that lucky, you need to have the right resource identification of the attributes to what your employee has to be and what you really want that employee to be. So it's a very small, thin line there. What you ask me is, how do you identify the best fit? Oh yeah, okay, you go forward, probably in the discussions as we go forward. You need to vent, there has to be a very professional system of venting the potential candidate. You start from the applicants, you start from the interview, then the hiring. You know, there's a word saying the purple hire. I think probably the CEOs here would admit here. Purple hires are the ideal hires. You have got your best guy whom you ever even dreamt about, that you just landed in your net. You're lucky. You're very lucky. I mean, you don't want to replace him for next probably 10 years. Yeah, but probably he also has to feel the same about you. It again depends upon your remuneration, about your location, your brand. Again, having said this, I would say, in my experience, probably I run one of the most branded diagnostic centers across the of UAE. I've been very fortunate. I think probably, it's a little bit. It's a family here. My sister, Dr. Farzan, she heads the HR department. She's done a brilliant job. Probably it comes from my heart. She was the best person for my institute. She has done a brilliant job, and that's why she's getting the award. But that doesn't apply everywhere. You know, you need to have that kind of statement. So having said that, there's a lot of elements where you need to vent professionally. The HR has to start from probably right from the application which comes in to you, where you have some kind of a professional system. Let's say we give them 24 to 48 hours. Let them answer your professional criteria to what you want in an ideal candidate. That could be one in terms of the initial vetting. Then there's the interview. You know what really happens in the interview? When I always say, that's the golden seat you're sitting in front of me. That's a brilliant seat, and you need to perform. They perform. They perform in front of the seat for the next 10 to 15 minutes. They owe you. They win over you. They really capture your. You will really fall in love with that guy. That night. 15. Is he going to sustain the next 2 years with you? Is the biggest challenge I always have faced. Me, my wife, and Dr. Yasmin, who runs the medical centers, we have been up teen times got very disappointed. We always felt at that time that guy was the best guy for us, but eventually, in the next 30 days, 40 days, he turned out to be completely a huge disappointment. So the whole HR factor is not easy. I'm telling you, being the chairman of Alhamdulillah, a very successful company, I still struggle trying to retain and trying to make a fit candidate into an ideal candidate. That's a challenge. It's always going to be a challenge. I think all CEOs here would going to admit on this, there's nothing like a fit candidate because you need to make an ideal candidate your efforts. It takes time, in my opinion.
Excellent, thank you very much. And on that point, the next subject we're going to talk about is financial losses due to improper recruitment. Now, you touched a little bit on it. Overseas recruitment can be disastrous if it goes wrong. Many times when we are recruiting overseas hires, we have to shell out a lot of fees on perhaps recruitment agency fees, relocation costs, hotel stays, just to give the employee a kind of thorough onboarding process while they are joining us. But especially if they're new to the region, within the probationary period, they might well leave. And this will leave us with quite a heavy check, a loss of staff and time. Time costs money. We do need to replace them. And also recruitment agency fees. Now, being a group recruitment manager of Saudi German Hospitals Group, I am a little bit anti-recruitment agency. I do pride myself in doing the recruitment in-house myself. And when I was at King's previously, I saved 1.8 million dirhams in recruitment agency fees, and I'm en route to saving 1 million at the moment with Saudi German. So talking about financial losses in the recruitment process, do you think that perhaps recruitment agency fees are contributing to this loss, or do you think that perhaps other factors could contribute to losses within the HR?
You know what, Helen, I think probably I've seen it up to times. We don't want to get into legal repercussions when we employ, when you put the best. So often when, especially, I just had a bad experience a couple of weeks back. I got a UK employee for 2 months. He was a perfect employee, and I think he was perfect in terms of his dedication, loyalty and all. But after 2 months where I felt somewhere along he was not delivering what we expected him to deliver, he threatened us on the legal repercussions. So that's where it happens that the financial losses is not so important for us than the replacement aspect. So I think you have a very good pertinent question here. What's important, the financial losses or the replacement challenge? I still tell my sister, I think we have a challenge not of the money, what I lost. Probably I lost 60,000 in 3 months, but the replacement is the biggest challenge.
Yeah, completely agree. Time is money. Yeah. Maybe we could open the question up to other panel members as well. I mean, what are your thoughts on financial losses due to improper recruitment?
Yeah, before going to the answers, I just want to tell you that this is a live streaming going on worldwide. We are, don't think that this entire program is watched only by this limited people. almost 140 countries we have viewers right now. So this is very important that if you have anything to comment on this one, after this one, you should open your mouth, because this should reach the world, your concerns. Then only we can take some corrective action. Okay, now coming back to this point, because this issue is not only in the medical, this issue is everywhere in the society, all the industry we are facing. First of all, we need to have a collective responsibility, especially in the HR department. When you have a requirement, it's an immediate requirement. The first thing you are thinking that if a person is available in another company, just you are taking it. This is the most unprofessional thing, because every organization is planning to have that employee for 2 years. They're planning everything is accordingly. All of a sudden, one employee is leaving. It takes time for that organization to find out another person. So it affects the entire ecosystem. So you need to have a long-term planning, that there should be a standby process. That is what now lacking in UAE. That's what now we are trying to fill up. Our medical council is trying to keep a stock of available persons. That is what our vision. So that you don't need to go and take a person from another organization for a short-term benefit. So we need to have a policy that you can take an employee from another organization, but only after when he or she completes that two-year term. Then, okay, after completing that term, okay, it is her choice or his choice to join another organization. So it's a professional way of living an organization. That way, lot of, because today you will do this unprofessional thing, tomorrow another guy will follow it.
I completely agree. I think that especially the healthcare market, it is quite saturated in the GCC, especially the UAE. So you do find companies trying to poach other companies' employees, and most with healthcare staff, you will find them moving to a competitor for a few extra thousand a month. So it is a real challenge that we're facing. So I like the idea that you said. What are your thoughts on the issue?
Regarding the losses incurred in terms of money, we do the capital budgeting or revenue budgeting in a year, but the losses suffered due to improper recruitment can happen on a weekly basis, monthly basis, quarterly basis, half-yearly or yearly. So much so that every time the hands of the chairman or the sponsor will be burnt. I would just draw your thought to the discrepancy or discordance that you find in a CV which you have received through a recruiter or through mail or through a friend directly versus seeing him on spot when he comes for an examination. Is there a huge difference? First, I would just make you feel the fact that you go through the educational details of a person. Suppose I am taking my own example in the Department of Neurology. You all know about the Tier 1, Tier 2, Tier 3 cities, etc. from the CV. I am from a place called Trivandrum, which is a Tier 2 city with an international airport from 1935, and you can study up to MBBS, MD, DM, PhD, postdoctoral fellowships, etc. And of course, bigger cities in India, in other European countries, GCC countries, and Egypt. Every nation has got its own charm. Now I am asking you to observe me. Studying in Trivandrum up to school, I did my MBBS in Himachal Pradesh, MD in Arunachal Pradesh or Assam, and DM in Madurai. Do you feel that I am extensively traveled? What is your inference? I am a bad student if I have done so. But if you urgently require a neurologist, you finally rope into my degree only. But then what happens? I have my frustration for MBBS. In a batch of 200 students, I was not able to perform well in an entrance examination, and so I had to do my MBBS in a Godam city. Of course, it is also accredited by the Indian Medical Council, and I have got a legitimate degree. Now the difference is, when I come back to work in a foreign country, I may have so many distractions. Relationships may be not nurtured properly, and my attitude and behavior may be different. But then other person in HR may think he is extensively traveled, he will speak 5 languages, whatever are my inadequacies, I only know. But the HR is telling, oh, he worked in Assam, he will attend to Assami, Bengali patients. He was in Gujarat, so he will speak Gujarati, Marathi, little bit of Pakistani, Urdu. So all my negativities will be converted to advantages when you see the CV. Now I have reached this country, taken the hard examination, and now see the difference. as a neurologist, I am only practicing. I am not doing a surgery. So leave my example and divide it between the medical side and surgical side. This is most important because the HR managers here are all well versed with the credentialing and privileging committee, which happens only after this fellow is on board. So the ideal recruitment solution is strip his academics then and there. Tell what you are expected to do. If you are a laparoscopic surgeon, which all parts are you using for laparoscopy? Whether you will use laparoscopy for appendicectomy, hernia, splenectomy, and cholecystectomy or gallbladder. So give that CNP activity much ahead. So much so that the losses from your side in recruitment due to lack of diligence will not happen. Of course, we cannot ask a physician for fever, what will you give, and intimidate him. So at the level of HR, actually we have to foresee all the problems that it could arise. Then regarding the facility, check whether he is mentally balanced to travel 4,000 kilometers from his country. He may be an Etihad frequent flyer because he is traveling because of discomfort. Every week he is going home. Does he want to bring his children for studies? And these social issues, I know you are much better than all the senior people in the panel. So this is the first way to reduce losses. Second, immediately you are changing a head of the department status or some other person is taking over from administration. It is a group concern. So many of our hospital owners have multiple hospitals. The HR manager or the regional manager who recruited you might have shifted from Abu Dhabi to Dubai. So the other person whom you might not have respected much earlier, now he is in that seat. So these touchy, cheeky, meeky issues may go into the second year when the contract is getting renewed. So all these things have to be softened by the H&R. You are here to treat people and you are here to follow a civil code of ethics, the medical ethics as well as the law of this land. Unless you are sure that all these are done properly, don't recruit. Even if a department doesn't have a staff for 1 month or 2 months, no patient is going to die. There are beautiful government hospitals in this country. In Dubai, Abu Dhabi, Sharjah, everywhere it is there. So just because in a private facility, one doctor is not there, no patient is going to die. So let us do less harm to the patients as well as less harm financially to our organizations.
Lovely, thank you very much. And actually, you took me on to my next point, which is going to be about quality verification of healthcare professionals in the GCC. Now, I find the system in this country quite good, actually. I mean, we have data flow, which really goes into the nitty-gritty of one's medical qualification, their previous workplaces and things like that. But Dr. Ajit, do you think that there is any problems with the verification process in this country? Do you feel like there are some flaws?
You've taken me back many, many years. I started my career as a pathologist, but very early in life, I became a medical superintendent of a postgraduate medical school in Chandigarh. This is way back in 70 to 76. Following that, I was asked to build an institution where I had to build the entire human resource from scratch. The day the first brick was laid, we started recruiting. It was the Sher-e-Kashmir Institute in Srinagar. Following that, I had the opportunity of building 26 hospitals across India under the banner. And the principal issue was starting from infrastructure, medical and allied equipment, human resource, and bringing them all together at a time when the hospital was ready for commissioning. And these hospitals, not necessarily including only hospitals, but even centers of excellence for medical education. So in the diverse field of medical, nursing, allied health programs, you have to bring them all together at the same level so that it is not the resident doctor who is actually nursing and nurse is doing the attendant's job. It is not uncommon to see in public hospitals. But what happened when I came back to the Emirates in 1994 as the Mustashar Wazarat-e-Saha, as principal advisor, I was given a very big challenge that we did not even have a staffing plan. We had literally almost 5,000 beds across government hospitals from Abu Dhabi to Ras Al Khaimah, but there were many problems of infrastructure, equipment, human resource. So we really did a staffing plan and see what is the criteria that gets into competence of an individual, whether it is a consultant, whether it's a resident, whether it's a nurse or head nurse, and so on and so forth. The biggest problem came up is my biggest impediment was that when you pass a professional exam, each country has accreditation bodies like WMC that you're creating. Every country has a council accrediting that the quality of training has been perfect, and then you're given a license to practice. Whether it's Great Britain, whether it's United States, whether in India, every country has a council. It so happened that there was a dispute between the Indian Medical Council and the General Medical Council over some problem, and both de-recognize each other. In the sense that when any Indian doctor or a nurse wanted to come to the Middle East or to Abu Dhabi and Dubai or other Emirates, he or she had to be re-accredited because GMC was recognized in UAE, MCI was not. So therefore we went through the process that we would almost become an institution to establish credence of individuals by an exam. And we started the exams for nursing and doctors while they were being selected. We also made some exemptions that if somebody was a professor for 5 years in AIMS, we would take him, or things like that. So going through this process, I would strongly believe that what you are doing is setting credence of individuals. And I have just recently gone through a process of not credence at the time of recruitment, but the time of awarding. I'm the chairman and of the jury of healthcare awards. We recently gave 50 awards to people from GCC. Everybody is fully aware of that. But coming very specifically to credence is that, and loss of, besides credence, loss of human resource that we cannot retain by virtue of the fact that it is the market which is creating this problem for us of grabbing the best of talent and taking them away. While you're recruiting, we always go through the credence and the background of the individual, where has he worked, what is his qualification, what is his reputation, what has been, how many years he has stayed where, and then you selectively pick up these people and bring them to your centers. But the moment you bring them in, the market is such that you are not able to retain them for good reasons that are known to. Now, I will stop here because of the fact that there's so much time has been spent on this specific issues, but credence is essentially at 3 levels. One, when you pass out, you have to be accredited by national accreditation body. Second, having had worked in some institution, you have already established credence and demonstrated your ability in that profession. And the third, when you bring them, have a contract in such a way that you have limitations to move around and leave the job that you are accepting. I think all these 3 things come very handy and are possible to implement. Thank you so much.
Excellent. Thank you very much. So the next point we're going to discuss is the need for quality and efficiency improvement within HR. Now, I do think this is something over the last few years that has been improved. I mean, I think you'll all agree once upon a time an HR generalist was doing everything in the hospital, everything HR related. But now what you'll find these days is that HR is breaking down into kind of subspecialties, you could say. So, for example, I am the group recruitment manager for recruitment. At my company, we've also got a group head for learning and development, and we've got a group head for performance management. So I do think that HR is going forward. But apart from that, I think, do you, Dr. Reza, think there is a need for HR to improve in any other ways?
Thank you very much for this opportunity. Thank you, Dr. Roy. Thank you, Dr. Shafi. Thank you, people. And it is a good opportunity for me to be part of this discussion. I have been into healthcare business for more than 3 decades. I came to UAE 21 years ago. I was part of Apollo Hospitals. I was the first DM of Indraprastha Apollo Hospital. I set it up in 95. Then I set up Belhol Hospital. Then I run RAC healthcare system. I am a healthcare business person. And for me, HR is very dear to my heart. because HR I consider as the most important resource of the organization. So for me, there are two important parts: human resource and human resource management and human resource development. For me, it is very important from business angle. My business positioning of the organization, what are the services I'm going to deliver? And it has to be based on the community needs. What is the need of my community? What are the services required? Based on that, I set up my business plan. Based on that, I put my HR plan. So for example, if I am opening a hospital in Ras Al Khaimah, I have to see the need of the community. Then I have to define the scope of services I am going to offer in that hospital. Based on that, I will set up a credentialing norm. Then I will look for the right candidate. That's the very, very important thing. For example, I started the first cardiac surgery program in Dubai in private sector 21 years ago. I brought Professor Roy Korula from CMC Vellore, spent 1 million dirhams to prove a point that cardiac surgery is doable and possible in this market. And after that, so many people picked up. So long story short, coming back to your point, it is very, very important because human resource development is very, very important. I'll give you an example. To hire a doctor is easy, but the biggest challenge is to hold a doctor. Because I have spent so much money in bringing a doctor from overseas. He has brought his family, he has relocated everything, his kids are going to school. Money may not be the primary criteria to hold him. I may pay him 100,000 dirhams, but giving example of Roy Korula, I gave him only one surgery in a year. But I'm a healthcare professional, I know what he requires. So I used to send him every month to CMC Vellore with a promise that you keep your knife alive and go and do surgeries. So what I'm saying is, it is not only selecting a doctor. The most important thing is I have invested into him and I have to retain him and I have to pass on the benefit of skill set to people. Now coming back to the development, it is very, very important for me. For me, not only for doctor, from my bellboy to a consultant, everybody in my hospital has a career plan and I work on that religiously. It is part of their appraisal system. Like if I have a bellboy and I see his communication skills are good, 5 years I promise him I will make you a salesperson. Same as the commitment of doctors. Every doctor in my hospital has an objective to acquire a new skill set. Like for example, I have an interventional cardiologist coming from Fortis, deputed to me, but he doesn't know pacemaking. So I will send him at my expense to Fortis, spend 2 months there, work with one of the best persons, develop that skill and come back. This is the example. So training is very, very important. And this commitment of leadership to employees is the key. For me, recruitment is not a big challenge. I know 30,000 doctors all over. For me, the biggest challenge is to get best use of him, to pass on the benefit of his knowledge, his skill to my community. For me, the biggest challenge is I'm a medical tourism specialist. I started medical tourism for India 22 years ago. When I came here, the biggest challenge for me is to provide care to the people here. For that, I have to have skillful doctors. I have to give him enough. Again, we were discussing with Dr. Shafi that so many hospitals are opening up. I said the biggest problem is that everybody is Me Too. We are copying each other. Nobody is trying to find a niche because everybody says healthcare, this is a land of opportunities. People open hospitals left, right, center, and suddenly everybody starts realizing there's too much supply. Okay, fine, go into niche areas. Still $7.4 billion are being spent on treatment abroad. Bring those specialties and offer to the people and develop confidence. So the development of doctors will help in retaining doctors. If I send them for trainings, compulsorily for CMEs, for educations, not only doctors, every employee in the chain is important because doctor is one link. everybody, doctor does 10%, 90% is done by other people. Their skill is very, very important. Their development is very important. Thank you very much.
Excellent. I absolutely loved what you were saying. I mean, L&D, it is something that really must be developed into. I mean, yes, it can be costly to train a doctor, but I guess the cost of replacing that doctor is much higher. Fantastic.
One quick point.
Sure.
There is I just wanted to mention that when I came to Wazir-e-Saha in 1994, there were 28,000 employees of the Ministry of Health. And the number of beds that we had and the load of patients on the government hospital was such, and private sector was almost non-existent. So there was a very significant issue of promoting the private sector. And that was it was ingrained as public policy to bring in private sector and incentivize them to establish healthcare infrastructure to complement the benefits. And this also promoted health insurance in a big way so that the private sector can survive. And it is not meant for free patients alone. So there are multiple factors. When we went through the 28,000 employees of Ministry of Wazir-e-Saha, we found that there were many deficiencies. So we did the staffing plan, we did the job description, we did the salary structure, balances, allowances, promotion policy, all that was defined in such a way so that they could imbibe the culture within the Ministry of Health and grow. The private sector would automatically come with these factors, but in the government you find that sometimes these are missing. So having gone through this process, if you talked about, we had introduced PPBS. The entire budget process was changed, and we found that 3.25% of the GDP spent on healthcare was increased to 6.5 during my time without imposing a burden on the exchequer. And that was because of the participation of the private sector, significantly. And you talked about human resource. Yes, we also introduced something called PABS, which is the performance-based evaluation system, which was based on MBO, management by objective, where you set your accomplishments to be attained in the entire year prior to the beginning of the year. And then the supervisor or the SSC and the assessor both are responsible for accomplishment. If somebody doesn't achieve what he is required to, the assessor is equally responsible. So there are many factors that were introduced, and I'm sure creation of Abu Dhabi Health Authority to autonomize healthcare, creation of Dubai Health Authority, they were all out of my desk. But I'm saying at this particular moment, we are talking of human resource. And since the private sector has grown significantly, we find that the grabbing of the best of talent will have to be safeguarded. Thank you.
Absolutely.
And I have a point, because from the end user, from the patient side, I just want to ask, because many times I changed the hospitals, not because of the doctor is bad or something, because of the system over there. Not only the doctors, the entire system, it is not working properly. Our impression about the hospital changes. So that is to be corrected. Not only that, nowadays everything is controlled by the insurance companies. I think Dr. Hussain should talk on this one, because before I used to take this medical card, I used to spend only 20 minutes or 25 minutes to consult the doctor, get my medicine and go. Now my medical bills are gone up by 10 times. And the time I have to spend is 3 to 4 hours minimum, because everything the insurance company should approve. After completing everything, to get the medicine also I need to wait another 30 minutes. So I think Dr. Hussain should talk on this to improve the efficiency on this one.